Welcome to the European Social Network podcast series. Listen to the stories and the voices from frontline social services across Europe. How are social services managing the challenges brought by the COVID-19 pandemic? Or how are they supporting people to handle the cost of living crisis? How are social services attracting people into the profession or promoting innovation to ensure access to quality social services? These are just some snapshots of topics we are going to discuss in this podcast series. Welcome to our very first podcast episode. I'm Alfonso Lara-Montero, CEO of the European Social Network. For those of you who don't know us, ESN, in short for European Social Network, is based in Brussels, and Brussels is the home of Belgian chocolate and waffles. ESN is a growing community of more than 160 organizations with responsibility for social services in 34 countries. We provide an international platform for exchange and aim to empower professionals and those using social services. For the rest, visit our website www.esn-eu.org to have more information about who we are and what we do. The idea behind this podcast series is to bring stories of social services to you. We are all aware of the constant pressure and challenges that social services face. This is why we want to discuss how social services professionals have faced and solved these issues. But we are also here to acknowledge the incredible work that social services do to improve people's lives. Today, we will speak with Harro Jogerverf, who is head of the Poverty Reduction Department in Amsterdam in the Netherlands, and with Georgia Chimbani, who is Director of Adult and Community Services in Suffolk County Council in England. Welcome you both, and many thanks for being with us today.
Good morning.
Good morning.
Today's theme is the current cost of living crisis and the impact it is having on social services. And I would like to start by asking you both, what are the issues that you see as directors of social services in the face of the current crisis?
Well, at this moment, we see a sharp increase of people in financial trouble. The difference with crisis before, the times before, is that also middle incomes are affected at this moment. To a certain extent, there is an atmosphere of panic because some people are confronted with electricity and gas bills that are very huge. So their balanced household finances are really disturbed. We meet a lot of people that come to our services and to our financial service surgery. And also we see people that are in such a big trouble that they go to ask for help in the food services.
In England, the picture is very similar as well. Inflation in the UK reached 11% in October 2022, and that's the highest that it's been in 41 years. So it's significant. What we're seeing as directors of social services is families are being faced with impossible choices. Do I pay my rent, or do I buy food? Or do I buy food, or do I heat the house? The cost of domestic gas and domestic electricity has shot up. So I think our estimates in the UK are domestic gas in the last year has increased by 129% and electricity by 66%. And really what this means for people is it's incredibly expensive. The cost of living continues to rise. Maybe to give an example, if you live in an area that has very low paying jobs, and maybe your chance of getting a higher paid jobs means traveling somewhere further away from where you live, your ability to actually travel, to actually go and work in a job that possibly pays you a lot more, will now be affected by very high petrol prices. Therefore, We're seeing people actually being forced to work locally, which of course impacts on the amount of money that they can earn, and of course their health and well-being as well. Suffolk is a county council that is a mixture of urban areas and rural, quite a lot of rural areas. And what that means for Suffolk is we have a lot of households that are off the national grid, which means that they don't get gas or electricity from the national grid. So they either rely on renewable energy, which is great if they have that in place, but most people don't, or purchasing oil for heating, which is very, very expensive. And also, we have quite a lot of older properties in Suffolk. That generally means that much more ineffective and expensive to heat. So one of my worries is we are probably going to see a huge influx of people being admitted to hospital with respiratory conditions, cardiovascular conditions, poor mental health as a result of poor or very cold living conditions.
A couple of years ago, the COVID-19 crisis, which is still, we still feel the consequences, the war in Ukraine then with the refugee and the energy crisis. Since that we've gone from crisis to crisis and we know how much this affects local social services, this is very much connected to the rise in the cost of living that you are referring to and we are all facing right now. How has this affected your own services and your team? Has there been an increase in the needs of people with whom you work? And how, what have been those new needs that you've been identifying over the past months?
I had to say that the effect of COVID turned out to be quite modest, except for a group of entrepreneurs, because we had a large scale funding of the government for employers to pay to continue the payment of their employees.
Mm-hmm.
And for the entrepreneurs, we conducted a vast program on local level. This was really a difficult thing to bring professionals together to carry it out, but we managed. And after a short fall of unemployment in these 2 years, the labor market turned out into a shortage of people. So very fastly we found people getting more and more jobs. But now we came in a really new kind of crisis, which affects much more people in their financial households, and which also affects people in a very, very different way, because we're living in an urban area here. We work in an urban area, so some people have very well and modern houses, which where the use of energy is very little. We have a private distribution of energy, so people have very, very different kind of contracts. Some have contracts that hasn't changed until now, but other people have variable contracts which can raise up to 3, 4, 5 times the amount of money they paid before. So for our social service, there is a very high need to identify those people that have really have the biggest problem. And of course, it is always more easy to give some general assistance to the large group instead of identifying the special needs of individuals, as we are talking about around 100,000 um, people in Amsterdam that are living around the lowest level of payment. That is a challenge because in generally we are more used to work in more general themes. So it is both a challenge on the street level where we have these advanced quarter teams, and also and sometimes even more within the bureaucracy in where general rules have to be changed to more individual scenes of assistance.
Thanks, Haro. It's interesting, isn't it, how many similarities we actually have across Europe. So, in the UK, certainly in England, the impact of COVID was certainly not as severe as it could have been. Again, similar to the Netherlands in terms of support from government in terms of income through furlough schemes. There were reduced travel costs for people as a result of hybrid working. But what we do know is what COVID did is it did expose inequalities that already existed in our communities. And that's something we recognize a lot more. We also recognize the importance of mental health. Because a lot of people were struggling during COVID with mental health, but positively as well, we saw great examples of how communities and organizations were able to come together through co-production to design more person-centered support. So ADAS, which is the Association of Directors of Adult Social Services, that I'm a member of and that I represent, do a survey every year that's sent to about 152 directors of adult social services in English councils. And the consensus is all directors are expressing a real concern about the cost of living. But what's interesting is it's not so much new need, but it's more an increase in existing needs. So those inequalities I've mentioned before, we're starting to see an impact, much more of an impact. We've started to see an increase in people, for instance, suffering falls in their houses due to poorly lit homes, because people are trying to save money on energy costs. So they're not lighting their homes very well. Poor nutrition and social isolation as people are cutting down on things, either on food or on socialization as a result of trying to make ends meet. I'm particularly concerned about unpaid family carers. In the UK, we really, really rely on family carers to actually, in a sense, supplement the support that we provide as social services. And we are starting to see some carers who are starting to consider the difficult choice of, do I continue to care for this family member, or do I ask for support from social services and go out and find employment? Another issue for us in England is we've always struggled to recruit social care staff. It's due to a combination of issues, but certainly what directors of social services are expressing is that they've started to see more people leave the social care workforce due to low pay. In Suffolk, where I'm a director, we know that some staff have transferred from working in domiciliary care, where they travel around the county in a car or on a bus or whatever mode of transport to visit and support people in their own homes, to actually working in a care home, because actually it's cheaper, because in a care home, all you need to do is get yourself to the care home, and then you spend the rest of your shift in the care home, so to speak, without needing to travel around with travel costs that are really expensive because of fuel costs. For many years, we've been concerned about the sustainability or viability of our care providers. So our care providers are the organizations where, as social services, we go and we buy care from them so that they then deliver care on our behalf to people who require the care. And what care providers are telling us is there's not enough staff to meet the demand for people who require support, and recruitment and retention is a real, real issue. So the cost of living means salary costs and, of course, expectations on staff for employers to keep meeting increasing salaries in line with inflation. Those expectations are increasing. Employers can't meet those expectations. And, of course, for care providers, running costs are escalating, and care providers can't keep pace with this. And, of course, this impacts the viability of businesses. So it feels very much like a vicious cycle, Alfonso. It just feels like it goes round and round and round.
You both have spoken of increased needs due to the rise in the cost of living. So, how are the social services in your communities responding to those needs? Were you prepared for these changes? Have you been able so far to address those changes with your own resources, or have you also received or requested support from higher level authorities to help you?
Yes, in the Netherlands, the focus of this crisis has been very much on energy because more than in other countries in Europe, the prices of energy has raised. We had already a program on that issue, which was orientated on the efforts to save energy in households for financial reasons, but to save it by improving your installations, improving the isolation of your house, and other kind of things. In fact, this program was supported by both our climate department and our own department because of the financial aspects for minimum incomes. And it was also oriented on minimum incomes. But the scale of this program was really, really small, or relatively small. And in this very year, it really exploded because of both professional voluntary workers and the civilians are turned into a big willingness to participate. And also for some people, of course, the climate goals and the prevention of buying Russian gas, it all turned into a coincidence of interest and a large scale of cooperation, both in the professional and voluntary field. On the other side, so the income side of the problem, our national government has really started a large financial public intervention, which made it possible for our local social service to support every household with €1,300 of energy support. So we had to form a large crew of about 40 to 50 people working on the distribution of this money. And of course, we based that on databases and our address records of the clients we know from kind of from other interventions before, which is around 70,000 people we already knew, and we can reach them by mail. But also we opened possibilities to ask for this support. And what is surprisingly that we met around 20,000 new households in a very low income level, mostly working people who have never had any relation with social services. But they turned up now to ask for this support. And it gives us a very good chance to relate with them and to search whether other kind of support, especially if they have children, are needed to find this balance in the household economy. So for our social services, this has been really a big chance to improve, although it has been a large challenge to get it all done. And we are still working it, and we hope to finish the distribution of this support before Christmas.
So I think what we've always been quite good at doing as directors of social services in England, or indeed in the UK, is recognizing that the people that we work to support always need some support or a buffer against the cost of living. But in terms of our response more recently, I think what we just didn't, what we weren't prepared for the increase of the numbers of people requiring support, or indeed the increase in costs. So the costs just rose really, 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 really quickly, rapidly. And it meant that anything that we put in place initially didn't feel as though they were actually supporting people enough. But I think now we do have a number of things that are in place. So a bit like Harrow has described, the UK government has also similarly put in place a number of things to support people. For instance, at the recent fiscal statement in October 2022, the UK government committed to ensuring that people who require state support in the form of benefits or universal credit, for instance, is one of those, that would rise at the rate of inflation. So that was reassuring to hear. They've put in place a number of support payments, for instance, £650 for cost of living payments for people on means-tested benefits, £300 for pensioners, cost of living payments, and an energy price guarantee cap. But this is still not enough. It's short-term support. It's appreciated, but it's short, sharp support, and can support people possibly for a couple of months, but it still leaves them vulnerable in the long term. So what we've tried to do as social services is try to put in place a number of initiatives to provide additional and support, and that's more targeted to help people. So, for instance, in Suffolk, we've put together a cost of living framework that helps people depending on their personal circumstances. So, for instance, if you are struggling with food bills, we can provide you with details of food banks in your local areas, or pop-up shops where you can fill a shopping bag with food for £2, or vouchers for pregnant women and children under 4 to buy food, or ways of reducing food waste through creative but very cheap recipes, or even buying food at reduced rates, that food that restaurants and takeaways would have thrown out at the end of the day. We also have a Suffolk Warm Homes initiative, and what that does is it provides support to make homes cheaper to heat. We also have another initiative, which is Warm Spaces, where people who can't afford to heat their homes can actually go to a designated setting like a library or a community center that's heated, so they can stay there all day. They can keep warm. They can charge their mobile phones or devices. They can have a warm drink and socialize. And that really, really helps people, because actually you've got somewhere warm to stay, and then you can go home at nighttime and possibly jump into bed and not feel the effects of a cold home as much as spending the whole day there. So there's quite a lot that I can detail, but hopefully this gives an idea of what UK local authorities are trying to do to mitigate the impact of cost of living for their communities.
Both of you have mentioned minimum income, financial benefits, and indeed minimum income schemes provide some level of social protection, and European institutions are encouraging national governments to put forward and revamp their national programs. How do you think the minimum income schemes can help address the cost of living crisis?
That is absolutely necessary. We have a minimum income already for many decades in Holland, but from the period of the financial crisis in 2008, this minimum income and the related social benefits are raised only very poorly. So people living on that level are really too far behind. Fortunately, our government now has decided to raise both the minimum income and the minimum social benefits at the 1st of January by 10% structural. So that is a very important step. But for us, this is only reparation of the past, reparation of over the years, over the situation over the years. And as we now faced by this inflation rate of around also 10%, we think that it should be raised even more next year. But of course, we are very happy with this 10% because it will create a more stronger basis in the very broad sense. As a local social service have to do is to as I mentioned in the beginning, after this general leverage of incomes, we created special assistance, financial assistance for individual situations. Until now, until before this year, energy costs were out of that scene because it was considered to be part of the regular household cost. But now we have opened the possibility that people bring their electricity bills. Also, if they are raised in that extent, that the general ways of support aren't enough to reduce the cost, to pay the cost, we give them individual support up to a couple of hundred euros per month. Unfortunately, or not unfortunately, we're happy to do it, but of course, it asks a lot of workers on our side, professionals, to find out these individual situations.
A bit like I said before, Alfonso. So I think the UK government has made a commitment recently to say that benefits would rise at the rate of inflation. So that's really, really positive. But I don't think that's enough to actually address the cost of living. And I'll tell you why. I think those inequalities that I mentioned previously are really, really important. So we know that there's inequalities in our communities, in relation to people's health outcomes, in relation to access to employment, or well-paid jobs, or access to energy efficient housing. And I think all of those come into play in terms of impacting people in terms of cost of living. So even if you gave people benefits that are rising with inflation, but people are still living in very energy inefficient houses, that still is an issue for people because that brings its own set of problems. Or if people are living in areas where there's a lot of pollution. They don't have access to green spaces to support their health and well-being, or support that enables them to live a healthy life. Those people will be negatively impacted than people living in different environments, because they'll have much more health problems. And of course, health problems, as we know, cost a lot in terms of people seeking support, and also cost a lot in terms of people's health and well-being. So I would say that there's a lot more that needs to happen to ensure, as in a sense, almost as a total package to support people, to ensure that people on minimum income schemes are adequately supported.
Imagine that you are addressing national and European policymakers. If you can make one request to them to help you address the cost of living crisis, what would that be?
Of course, in our national government, we have many requests for them. If I choose the most important, I think in the first place is the problem of people without legal documents. The COVID crisis brought us in contact with many initiatives in neighborhoods where people collected food for uh, illegal people living in Amsterdam in an illegal way. And of course, those people were cut off any support and cut off any income during the lockdown period. But after this period, we found out that we kept in contact with them because many of them are structural in a very bad situation of living. So the improvement of that situation is probably the first thing.
I think the inequalities that we've just described, Hera and I have just described, I think that's really, really important. We do need to reduce inequalities in the community, in our communities. If people don't have good health or access to employment, or good employment, well-paid jobs, that has an impact in terms of support that they require from social services. And indeed, it costs the government even more money. So I would say that by reducing those inequalities, what that does is it empowers people, it supports people, it gets it just communities become much more vibrant and much stronger and more resilient, actually, rather than, in a sense, being done to and being provided with things. And we know from COVID that actually communities are very able to do that if they're given the tools to be able to do that.
Thank you very much, Georgia and Haro, for being here with us today. We've just arrived at the end of the first ESN podcast episode. We've listened to interesting insights into the impact of the cost of living crisis for social services in Amsterdam and Suffolk, realities that many of us are not aware of. For our audience, we hope you enjoyed it. Thank you very much for listening, and tune in for our next episode at the beginning of 2023.